Hi, my name is Chris, and welcome to my YouTube channel, To Your Health. As most viewers probably know, new strains of SARS-CoV-2 are emerging, which today indicate they are more contagious. As a pharmacist, I wanted to create a quick video discussing simple steps you can take to reduce your odds of contracting COVID-19 or reducing the severity of symptoms should you get it. Some of these ideas are relatively new, so the mechanism of action is not completely understood at this time, but the bottom line is the end result is beneficial. At this time, vaccines are being administered in the US, but according to the New England Journal of Medicine, the Pfizer vaccine doesn't provide protection until day 12, and even then is only 52% effective. The efficacy rate rises to 95% after the second dose. This means that even after vaccination, there's still a chance you could contract the virus. So until this pandemic is over, it's best to remain proactive. Let me begin by saying that viruses enter our bodies through our nose, mouth, and the corner of our eyes. One of the best ways to avoid catching the virus is to wash our hands frequently and thoroughly. Another simple step is wearing a mask. After a lot of dithering, the CDC finally confirmed that masks do slow down the spread of SARS-CoV-2. N95 masks, like this one, offer the most protection. I was able to purchase some online from Enviro Safety Products in California. If we breathe in SARS-CoV-2 virus, it usually hangs out in our nasal passages a bit, replicating itself. At night, the virus can migrate into the back of our throat, and some may find its way into our lungs. Using a Neti Pot, like this, before bedtime could flush some of the virus out of our nostrils, reducing the viral load. But if you choose to use a Neti Pot, be sure to use distilled water rather than tap water. Saline sprays or a saline gel have shown effectiveness in also reducing the viral load in nasal passages. And this nasal gel contains aloe vera, which helps dry passages during the winter. Vitamin D. Preliminary studies have shown that people who have low levels of vitamin D had a significantly higher risk of dying from COVID-19. In one small study of 50 patients hospitalized with COVID-19, all were given a high dose of calcifediol, which is a type of vitamin D. Only one patient needed treatment in the intensive care unit. Eastern Virginia Medical School COVID-19 protocol suggests 1,000 to 4,000 international units per day. Zinc is an essential micronutrient necessary for growth and a healthy immune system. The recommended daily allowance is 8 milligrams for women and 11 milligrams for men. Many multivitamins on the market include zinc. Zinc comes in many forms, from a nasal gel to lozenges like these coldies to tablets. It was previously known that zinc can reduce the duration of colds, and now a few small studies show that it reduces the severity of COVID-19 symptoms. If you're shopping for a zinc product, zinc citrate is better absorbed than zinc sulfate, and in most of the studies, the dosage form most often used was tablets. As a prophylactic treatment, Eastern Virginia Medical School's protocol suggests 30 to 50 milligrams per day. There are some contraindications between zinc and other medications, so please consult with your pharmacist before adding this to your drug regimen. Maitake-D fraction. These capsules contain the fruit bodies of the maitake mushroom. Studies have shown it boosts the immune system in immunocompromised patients and has been used as an adjunctive treatment in certain cancers. It comes in capsules and a liquid. Recent research shows that those who take probiotics, whether via capsules or food sources, had a lower risk of contracting COVID-19. Studies from the Cleveland Clinic and University of Toronto determined that melatonin was associated with a significantly lowered risk of contracting COVID-19. The normal bedtime dose is 3 milligrams, but some studies dosed patients with 10 milligrams. Melatonin was one of the drugs President Trump was given when hospitalized for COVID-19 back in October. Thanks for joining me, and please stay safe.